Hi, good afternoon. My name is Mohammed Aslam Hossain. Sorry for the interruption. Hi, good afternoon. My name is Mohammed Aslam Hossain. I am a PhD candidate in the Department of Economics. Today, I'm talking on my research topic, depression and addictive behavior in Manitoba. Depression is one of the most common mental disorder that is affecting 1 in 8 Canadians at some point of life. It is not only affecting mental health but also our physical health, and it could affect our personal life. It has social consequences as well as it has economic consequences. There is a growing literature on substances use and mental health, such as depression, stress, and anxiety. Unlike most studies focusing on a single substances, these studies actually consider multiple substances used, including alcohol, cannabis, and smoking. We have two specific objectives for our research. We're going to estimate the prevalence of depression by socioeconomic demographic characteristics and the level of substances use in Manitoba. And we also examine the effects of substances use behavior on depression. So the data we are using for this study is from Canadian Community Health Survey cycle 2019-20, and our study is actually cross-section in nature, and the sample size contains Manitobans adult is 18 and over, and the sample size is over 6,000. And we get the data access from Manitoba RDC, a part of CRDC and network. And the most advantage why we're using RDC is that we can able to use the master data with Bootstrap while we can use the Bootstrap here. Uh, for the analytical methods to test our first objective, we are using bivariate analysis and chi-square test. And for to see the association of substances use on our mental health, depression, we are using multivariable logistic regression analysis. And for the robustness check, we're using some others regression, ordinary least square, and multivariable probability regression analysis. So this is the study measures for my research. So the main outcome variable for my study is depression, which is measured by using patient health questionnaire developed by Kroenke et al. And in 2001. Uh, PHQ-9 is one of the most validated approach to measure depression, which is introduced in CCH 2015 and 2016 cycle. And based on its score, which varies from 0 to 27, they classify depression into 5 categories. So from no, mild, moderate, moderately severe, and severe depression. And the addicted behavior that we derive from the consumption of substance, smoking, alcohol, and cannabis, and based on the intensity and the frequency of using substances, we classify into each of them into 3 types. For example, smoking, not at all, occasionally, daily; alcohol, similarly, current non-users; occasional drinkers, regular drinkers; and cannabis, current non-users, current users, and current heavy users. And from our model, we also control the confounders, social demographic, including age, sex, marital status, population center, education, and household income. So this is the summary, like how I set up my research questions. These are some preliminary findings. So we find that about 2.3 million adults, that is actually over 24%, adult reported that they are suffering from mild to severe level of depression. And among them, female are actually suffering more, that is over 60% compared their male counterpart, which is around 39%. And in the age group, we see that the young age and the working age group are actually are affected most by the depression. For example, from 18 to 14 years age group, around 50% are actually reported that they are suffering from mild to severe level of depression. But overall, we see that like the those who are old age, they are actually suffering less. So this is some primary analysis, but after conducting entire research, we can have more heterogeneity effect we can show. So this study has some policy implication as it studies heterogeneity across demographic groups. After conducting the entire study, I think we will able to provide more specific policy suggestion regarding depression and addictive behavior, including cannabis, uh, alcohol, and smoking. Thank you. If you have any questions, please you can ask us.
Thank you for your presentation. I don't see any questions and we are a bit short for time, so we're going to move on to our next presentation.